Before you complain about your next dentist appointment, stop. Just for a moment. Because there was a time when the person pulling your tooth also shoed your horse. A time when anesthesia was a leather strap and a mug of ale. And a time when the scariest word in the village wasn't war or plague, but pliers. Welcome to Little Historical. Here's a question for you. Would you rather feel a cavity drill today, or let a blacksmith yank your molar with rusty tongs? Think about it. Because in medieval Europe, that wasn't a hypothetical. That was Tuesday. If you enjoy history that makes you grateful for modern medicine, go ahead and hit subscribe. And maybe, just maybe, leave a like before we dive in. Because trust me, after this, you'll never skip brushing your teeth again. Close your eyes for a second. Imagine a room with no lights, no gloves, no numbing cream. A man in a blood-stained apron holds a pair of iron pliers. They were used on a horse this morning. And now, they're coming toward your mouth. What do you do? That was the reality of medieval dentistry. No degree, no license, no mercy. Just pain, rust, and a prayer that you wouldn't faint before the tooth came out. This is Little Historical. Today, we're asking a simple but disturbing question. Why did it suck so badly to be the person doing the pulling? Before we answer that, do me a favor. Subscribe to the channel. Hit like if you're glad you live in an age of anesthesia. And let's walk slowly into the nightmare together. You're 15 years old. You've never been to a school. But you've held down 3 screaming farmers while a barber-surgeon pulled their teeth. Now it's your turn. The pliers are in your hand. The patient is crying. And there's no one to help you. That is how you became a medieval dentist. Here's what I want you to think about. What would you do differently if you had no anesthetic, no antibiotics, and no second chances? Welcome to Little Historical. If you're curious about the answer, and I think you are, then subscribe right now. Tap the like button. And let's find out why this job was the worst job in the Middle Ages. There is no ceremony when you become a medieval dentist. No diploma, no white coat, no older colleague shaking your hand and welcoming you to the profession. Instead, there is only a barber-surgeon with stained sleeves and a tired voice, pointing at a pool of blood on the floor and telling you to clean it up. You are maybe 12 years old. You have already seen things that would make a modern medical student faint. But you stay because staying is easier than explaining why you want to leave. The barber-surgeon notices that you do not flinch when the screaming starts, that you do not turn away when the pliers sink into a rotten molar and the tooth cracks instead of coming clean. He sees something in you, a stillness, a hunger, or perhaps just a numbness that looks like courage. And so he begins to teach you, not with words, but with silence and repetition. Hold this head still. Pass me the hook. No, not that hook. The one with the wider curve. You learn the weight of a man's jaw when he is too proud to cry. You learn the sound a tooth makes when it surrenders, a wet little pop that you will hear in your dreams for the rest of your life. But there is another lesson too, one that no one speaks aloud. The barber-surgeon has a way of looking at patients that makes them quiet before he even touches them. He does not rush. He lets them feel the cold iron against their cheek. He lets them imagine the pain before it comes. You begin to understand that fear is a tool, sharper than any pliers, and you begin to practice it yourself. You learn to lean close when you speak, to let your breath warm their ear. You learn to rest your hand on their shoulder just a moment longer than necessary. Not cruelty, not kindness either. something in between. A promise that you are in control, and they are not. The first time the barber-surgeon hands you the pliers and steps back, your heart pounds so hard you taste metal, but your hands do not shake. Your voice does not crack. You look the patient in the eye and you say nothing. And when you twist, and the tooth comes free, and the man slumps forward weeping with relief, you feel something shift inside you. Not pride, not pity, just a quiet certainty that you will never be the one in that chair. That is how you become a medieval dentist. Not by choice, by surrender. And the story does not stop there, because soon you will learn that the worst screams do not come from the patients. They come from the moment you realize your own mouth is rotting too. And let's find out why this job was the worst job in the Middle Ages. You try not to think about your own mouth. That comes later. For now, there is the toolkit, and the toolkit is a nightmare wrapped in rust. The barber-surgeon keeps his instruments in a leather satchel that smells of old blood and older sweat. He does not clean them, he does not boil them. He wipes them on his apron between patients, and that is considered hygiene. The first tool you learn to love and fear is the pliers. Not the delicate kind you see today. These are thick, heavy, forged for pulling nails from horseshoes. The grip is rough iron, and when it closes around a tooth, you feel the patient's entire body tense through the handles. You learn to twist slowly, not because you are gentle, but because a fast twist often breaks the tooth in half. And when that happens, you have to go back in with the hook. The hook is worse. It is a thin metal claw, curved like a question mark, designed to dig out roots that refuse to leave. You slide it into the dark hole where the tooth used to be, and you scrape. The sound is terrible, a wet, grinding squeal that makes your own jaw ache in sympathy. Sometimes the root comes out clean. Sometimes it crumbles. And sometimes you feel the hook slip and catch something soft, and the patient's scream changes pitch entirely. That is when you know you have touched the nerve. But there is another tool too, one that the barber-surgeon only brings out for special cases. The mallet, a short, heavy wooden hammer. He places a metal rod against the tooth and tells you to hold the patient's head still. Then he taps, not hard at first, just a little tap to see if the tooth will loosen. If it does not, he taps harder. You learn to watch his eyes during this part. He enjoys it. Not in a cruel way, more like a carpenter who finally gets to use his favorite chisel. He breathes slower. His hand steadies, and the patient, pinned beneath his grip, understands that begging will not help. You wonder, sometimes, if you will ever enjoy it that much. Then you push the thought away and reach for the pliers again. Because the toolkit is not just iron and wood, it is a mirror, and every time you use it, you see a little more of yourself reflected back. The next keynote waits just ahead, where the patients open their mouths and show you exactly what decay looks like when it wins. And then the patients open their mouths, and you understand why the barber-surgeon never eats before noon. The first thing that hits you is never the sight. It is the smell. A warm, wet stench that rises from the back of the throat like something crawled inside and died there weeks ago. You learn to breathe through your mouth, which only makes it worse because now you are tasting what you used to smell. The teeth themselves are landscapes of ruin. Blackened stumps leaning sideways, cracks that run deep enough to hide a fingernail, gums the color of bruised plums, swollen and shiny, bleeding the moment your tool touches them. Some patients have abscesses the size of walnuts bulging from the jaw, hot to the touch, pulsing with every heartbeat. You learn to lance them quickly. The pus that comes out is yellow and green and smells like a battlefield after rain. But it is not the worst part. The worst part is what lives inside. Sometimes, when you pull a tooth that has been dead for months, You see movement, tiny white specks wriggling in the dark hollow where the root used to be. Maggots. They love the warm, wet rot of a neglected mouth. You do not scream anymore. You just scrape them out with the hook and try not to think about how many you have swallowed in your sleep. The patients themselves become a blur of faces and open jaws. There is the baker whose gums bleed when he blinks. The widow whose remaining teeth point in 7 different directions like broken headstones. The farmer who grips your arm so hard during an extraction that his fingernails leave crescents in your skin. You begin to recognize people not by their names, but by the geography of their decay. Ah yes, the blacksmith with the abscess under his tongue. The wool merchant with the molar that crumbles into black sand the moment you touch it. And through it all, the screams become your lullaby, high and thin from the young, low and guttural from the old. Some patients go silent just before they faint, and that silence is somehow worse than any noise. You learn to work through it, to let the sounds wash over you like rain on a roof. But one sound you never get used to is the wet gasp of relief when it is finally over. Because in that gasp, you hear something unexpected. Gratitude. And that is almost more disturbing than the maggots. Soon, you will learn that gratitude does not protect you, because one day, the rot will come looking for your own mouth, and there will be no one left to pull the tooth but yourself. It comes for you on a Tuesday, not with a scream, but with a whisper. A dull throb in your back molar that you ignore because you have work to do. There are patients waiting, mouths to empty, teeth to scatter into the bucket beneath your bench. But the throb does not leave. It grows. It crawls up your jaw and settles behind your eye like a splinter you cannot see. You try to eat. You cannot. You try to sleep. You dream of worms. By the 3rd night, you know what is happening. You have seen this 100 times in 100 mouths. The rot has found a home in your own bone, and now you must decide. The barber-surgeon is gone. The apprentice is too young, too shaky. You could travel to another village, pay another puller to do the work. But that would mean opening your mouth for someone else, letting a stranger touch your tongue. Hold your head still while you cry. And you cannot do that. You have seen too much. You know what they think of patients. You know what they whisper afterward. So you wait until midnight, until the village is asleep, and the only witness is the candle on your bench. You heat the pliers over the flame, not to sterilize, just to feel brave. You wedge a wooden block between your molars to keep your jaw open. Your hands are steady. They have pulled hundreds of teeth, but never from a body that feels pain the way you feel it now. You find the tooth, a lower molar, black at the gum line, tender to the lightest touch. You position the forceps, you take a breath, and then you twist. The pain is not what you expected. It is worse. It is not a scream. It is a white explosion behind your eyes, a wave of nausea that turns your stomach inside out. You taste blood. Hot and salty, and yours, the tooth cracks. Of course it cracks. You reach for the hook, fingers slippery with sweat and copper. You dig. The sound is wet and wrong. Your vision blurs, but you do not stop. Because stopping means leaving a root behind, and a root left behind means infection, and infection means death. So you keep digging until the last fragment comes free with a wet pop that you have heard 1,000 times but never felt in your own skull. You drop the pieces into the bowl. They clink against the others. You lean back. Your mouth is a cave of raw meat. And for the first time in years, you understand exactly what every single one of your patients was trying to tell you. The story is not over. Because after you heal, you will go back to work. And every scream you hear from that day forward will sound different. It will sound like your own.